Welcome to the Friendly Aussie Podcast.
Welcome to the Friendly Aussie Podcast. And today we have Dr. John Tay from PlantMed, Australia, one of the leading cannabis experts in prescribing medicinal cannabis in Australia. We've brought him on today to kind of have a chat a little bit about the medicinal scheme, a little bit about his background, and just to inform our audience, who is predominantly a recreational audience, a little bit about medicinal cannabis, maybe if it can apply to them, and just kind of go from there.
What's going on, John?
G'day, thanks for having me, guys. It's really nice to be here.
Thank you.
Lovely to have you.
So 2016 comes around, and you were one of the first doctors on the scene to kind of get interested in prescribing cannabis. What brought you to there? Like, where was your interest developed from in cannabis? Was that an early thing? And how did you come to be the great Dr. Tay?
You're too kind. Thank you very much. Well, you know, cannabis is always something which has been around. I mean, it's around in life. And university, of course, it sort of floated past me, as so to speak. But really wasn't a major part of my life until later on. And so after university, I started my doctoring career, and I was doing a totally different path of medicine. And a family friend of mine, a young lady that called Nikki, she was 21 years old, came to me just after her 21st birthday, where she'd had to be taken in for an emergency brain surgery for a really bad type of cancer called GBM, which is very deadly. And she didn't know what to do. She'd heard that medicinal cannabis was a thing, and she knew that, you know, I was a doctor, and she came to us and my wife for advice. And that was just pre-legalization. So I've been following medicinal cannabis. I've been researching it. You know, there's a lot of work overseas, obviously, for decades. And we started to develop a regime for her, but it was obviously based out of the what I like to call green market or compassionate market in Australia for medicinal cannabis. So it was, you know, via the NIMBIN connections, as a lot of these things are, and we helped her out a lot. Unfortunately, she did pass after a few years, but she had an extended lifetime and much reduced suffering. You know, in that time, she got to spend it with her family. And it wasn't until right at the end where she was like, I've had enough, it's time to go. And it was well past the time where she should have technically gone. But the struggle with that really got to me. You know, there was times where she would run out of medicine because it was just not available, because the supply was, you know, not constant. We weren't sure of the strength or what strains we were getting. We just got, you know, a random brown paste in a tube. And that really hurt me to see someone suffering. And not being able to access something which was so, you know, good for her. And it was right at the beginning, as we progressed through looking after her, cannabis became legalized in Australia. And I actually was a little bit naive about how to apply in those days, and I applied for her to help fix her cancer, which obviously isn't something we're allowed to prescribe cannabis for, to fix cancer, because we can't provide evidence of that. And so, you know, I went through that process, and it was a learning process for me as well in that stage, filling out paper forms to get medicines. I was rejected multiple times, and it really frustrated and made me angry that people couldn't access this really safe, really amazing medicine. I was probably going to retire and grow veggies in the hills. I'm really into permaculture, and I've got a property, and I was planning on just having a kid. Well, my wife was actually pregnant at the time, before any of this occurred, and in the process of birthing that child, we birthed PlantMed as well. It was almost accidental. We had some, you know, altruistic investors who we've since bought out because they had other things that they wanted to do, and that led into PlantMed. So now we've got thousands and thousands of patients which we help daily, and yeah, that's how I got here, really, in the cannabis industry, and been here since the start. Was one of the first handful of doctors to have an approval. And back in 2016, an approval might take a month or two or more to get approved. You had to write on paper with a pen, fax it or mail it into Queensland Health and the TGA before getting a dual approval back. And that process could take a long time. And the medicines at that stage were very expensive. Medicines now, which might be costing about $200 or $300, will $600 plus for some, and some times.
I remember ounces back then were like, people were talking about $1,200+.
Yeah, flour wasn't readily available back at the start either. There was available, but it was more really oils that were being utilised because the medicinal market's different to the recreational market in that sense. People aren't looking to smoke cannabis; they're looking to fix their ills. But there's definitely been a massive uptick in flower use in the medicinal market now.
Obviously, at the beginning of the scene and the scheme, it would have been one of those things where there weren't that many product options, maybe limited options available. But how do you think that's changed since 2016?
Oh, massively.
Yeah?
There would have been, like you say, a handful of products. I mean, there was one company initially, the
Yeah,
first
right.
one, and
Wow.
we won't say any names, but, they only had a few products in Australia at that time imported. Fast forward to now, I think there's,
Over 150.
there's over 150 listed products on the TGA.
That's a lot.
Not all of them good.
Yeah,
but
right.
a lot of them very good, and the choice is much wider now. Yeah, we've got a large selection of oils, alcohol-based oral medications. You've of course got your flour.
Yep.
There's even some concentrate which has just entered the market as well.
Okay.
There's sublingual sprays.
Yeah, great.
Wafers which are designed to dissolve through the mouth.
Oh,
So
wow.
there's a lot of products, and if you go to a doctor and they've just only got the one type of product, you should say, well, why? There should be a bit more selection. Why are you offering me only this one type of product?
Right. Why is it that a doctor would only offer a
Well, I
product
think
or
it's
two products?
education,
Okay.
and sometimes doctors are approached by people in the industry, producers and their representatives,
Sure.
which will help them get their authorized prescriber status.
Yeah, right.
Meaning they can just write a script for certain products.
That makes sense.
But then those doctors often haven't been educated in cannabis generally and all the other medicines, so they just stick with what they can just write a script with and not have
Okay.
the hassle.
Yeah, that makes
and
sense.
the admin side of things. I
Sure,
think. Yeah.
sure. I mean, a lot of doctors would be focused on other things primarily, right?
Yeah, well, I think a GP in their general practice wouldn't have enough time to, do a proper cannabis consult as I would do one.
Fair enough.
They're under a lot of time pressure, and simply the paperwork alone would probably take up your 15 minutes of consult time.
Yeah.
So, that's something that at PlantMed we really focus on, is we have a lot of time put aside with our patients. We spend 45 minutes to an hour in that first consultation, really talking to the patient, finding out what they need, what their experience is, what their ailments are, how we can help them in the best way, not just a cookie cutter sort of one size fits all approach. Yeah.
Okay. So that's kind of where PlantMed comes in. It's like the personalized approach to, authorizing and prescribing yourself through the TGA program. Is that kind of what you guys do?
Yeah. We consider ourselves specialists.
Okay,
We get referrals from GPs, and we get referrals from medical specialists like neurologists, psychiatrists, pediatricians. So, you can go to your GP, but once you're outside of their knowledge range, they will refer you on. And that's where we position ourselves.
Yeah, right.
We like to think that we've got that little bit extra skill and knowledge to really help people in a more personalised way, because cannabis medicine is so personalised. It's not just have this one-to-one oil, have a mill once a day and you'll be fine.
No.
That's not going to work,
Yeah, right.
So, if someone comes in and they are an experienced recreational user, or, it's a very fine line, isn't it,
It is,
between
yeah, it
recreation and medication.
The only difference is that most rec users don't know a thing about dosage.
Yeah, I mean, usually dosage is a bit high in the recreational market, perhaps. But, that's something that needs to be taken into consideration. If you come to PlantMed and you are a recreational cannabis user, or you're using cannabis, to self-medicate, whatever your choice of terminology, that's taken into consideration. We're not going to give you a CBD-only medication
Right.
if you're already smoking 15 bongs a day, for instance. So it does
point.
change the perspective of how we treat people, for sure.
Yeah, it's one of those interesting things when you talk to people who are very much on the rec side, and they talk about, getting dank strains with high THC, and how they need to smoke maybe 15 bongs in that one day. And it's like, how much CBD are you taking? And it's like, none. And then you start to go, well, if you maybe took some CBD, maybe you wouldn't need the 15 bongs.
Yeah, I mean, there's definitely the CBD component. I'm a really big believer in CBD.
Me too.
I do take CBD myself. I find it's really important. It supports our bodies naturally. To me, it's a nutraceutical.
To me, it's a supplement, right? right?
Yeah, it's a supplement. It's something that prevents disease, but it has a lot of other benefits. You know, CBD will keep our circulating anandamide in circulation for longer. So the enzyme which breaks down our natural cannabinoid, our main one in our body, it's inhibited by CBD. So that means that anandamide will stay in circulation longer. It reduces the negative high effects of THC,
that's what I was about to
which
say.
is a really big one. You know, in the recreational market, I'm sure you've all got friends out there who are just that little bit edgy, that little bit manic, fast, anxious all the time. And often that's a result of excessive THC consumption without balancing CBD. So at PlantMed, you're all welcome to come in and see us, but realize that you will be given CBD when you come to see us because it's an important part of the plant. And it's been bred out over the last 100 years because people want the highest possible THC for that psychoactive effect. But in fact, as everyone knows, CBD's come back in with massive popularity.
I actually I had the weird honor of finding out that there's CBD flower, CBD buds, across the TGA platform, and it's
There
made me
definitely
want
are.
to join because the idea of CBD buds really excites me.
CBD buds, yeah. I mean, you obviously don't get a high effect when you smoke them or vaporize them. You know, they're the ones. There's a few available. One of them is about 14% CBD, 1% THC, and there's also some balanced strains coming in. Not balanced between indica and sativa, but balanced between CBD and THC. So, because of the way plants grow, they're usually not as potent as your high THC varieties. So one of the ways in which I will use that CBD flower is to mix it in with your high THC flower. So you're eventually creating your own more potent, balanced CBD THC hybrids.
Yeah, that's what I personally do.
Yeah, that's right. You just sort of mix a bit in and it just takes away the edginess. CBD will also extend the duration of your THC high because it will reduce the breakdown by an enzyme in the liver called cytochrome P450 of THC itself. So that enzyme breaks down THC and CBD will slow down the activity of that enzyme. So you're getting extended duration of action from your CBD
So is that
addition.
kind of why it does feel like it kind of makes your THC weaker because it slows down the uptake? Is that kind of the process?
There's a couple of ways. Yeah, so it makes your THC last longer because it won't get broken down as quickly. CBD binds what's called allosterically to the cannabis receptors in our body. That means on the side of, so it doesn't fill the cleft up. When CBD binds to our cannabis receptors, it slightly changes the way they're structured, and that slightly changes the way that the THC can lock in, and that reduces a little bit of that, what I call the anxious, more cerebral high, which can happen, especially with sativa varieties cannabis. So especially with sativas, a lot of people, they think they love sativas, but I'll actually won't give them a sativa on purpose until I've stabilised them, as from a medical point of view, because there's no point giving someone what they've already tried a million times and getting the same result, anxiety and a, uncomfortable situation. Sure. So I'll often slow people down, reintroduce a hybrid, and then once I'm happy, I'll then, send them back to sativas. One big thing when you come to see PlantMed is sometimes you don't get what you want, you get what you need. And some people don't like that.
Yeah.
And they can stay in the recreational market. I think, if that's what you want, that's fine. You go do it. But in the medical market, something different. You're paying for someone's expertise.
Yeah.
And it's foolish not to take advice from them.
Yeah, that's a big one, isn't it? Because we all know smokers who have maybe even been smoking for like 30 years and, they regard themselves as, quote, experts. But how much do they actually know behind the science and the actual way of applying it medicinally? Of course, maybe how to grow it, how to smoke it, like all of that. But there's a lot more behind it, as you've just kind of explained. Yeah. One thing that I think is kind of interesting, we've talked about CBD, THC, but we don't talk about any of the other compounds yet in Australia. Like we haven't talked about CBN or I think it's CBG and all of this. THCA is a big one for some people. And it's kind of, I don't know, maybe borderline frustrating on my end to just see we've got this medicinal program, but this is all we're kind of looking at. And it's the whole plant there's so much more to it. Do you see that changing in the near future, or is that a while away?
No, that's already changed, and it's just transmission of knowledge. Actually, you know, most people haven't heard of the minor cannabinoids. That's so cannabigerol, cannabichromene. There's over 144 minor cannabinoids
That we know of.
that we know of. That's right. That have been so far isolated. You know, the two main ones are THC and CBD. They're the big ones. They're the ones that have the main effect. But those other minor cannabinoids definitely do change the subtle effects of the cannabis, as does the terpene profile. And I think the terpene profile may be more important perhaps than some of these minor cannabinoids. But we don't need to judge more or less, because they all need to be there. And that's why we at PlantMed at least believe in whole plant medicines. We don't use isolates except in extenuating circumstances, like, you know, if you're a truck driver in a mine and you can't take THC, it's not an option for you. So when we look at the information that the suppliers give us as doctors, they do provide sheets that have, you know, often terpene analysis and minor cannabinoid analysis, as well as, you know, analysis for fungal spores, bacterias, excess growth mediums. You know, we don't have any PGR problems in medicinal cannabis, because these products all are tested for residues of growth, you know, and if they're incorrectly flushed, well, that will show up as a chemical that's not meant to be in the plant, and that will throw them out, and they'll have to redo that.
So PlantMed does say fuck PGR.
in more polite terms, but yes, we agree with that. We do agree with that. So, you know, I've seen one site, at least, I think it's called Rate My Medicine, where somehow information from, you know, these terpene profiles and sort of things have been, you know, uploaded by the public when they've received the information from their doctor. And so there is that information out there to have a look at.
That's great.
And when you're looking at, you know, we always talk indica and sativa, that's definitely a recreational term. When we're looking medically, there's actually sort of an academic argument going on whether those terms are even relevant.
Right.
You know, is there indica, is there a sativa, or are we just different chemophores?
I mean, they're definitely different types of plants, right? Like,
Definitely.
they grow differently, but are the effects actually what they translate into, you know?
I think on the ground, yes, they are, and I definitely attribute, you know, uplifting to sativa, sleepy or somnolent to indicas.
But is it their terpene profile, right?
Well, that's right. That's the argument, that it's about terpene profile. And so, for instance, there's
I'm kind of sitting on that side of the argument these days, because I'll have an indica and it will affect me completely different to another indica. And it's the same with the sativa. I can have one sativa, it'll affect me completely different to another sativa.
Exactly right. And that is to do with terpene profile and also the background breeding, you know, so the indica sativa ratio. So you can have a full indica, or you can have a 30% sativa, 70% indica in the breeding.
Right.
But really that's referring to the terpene profile. True. So when you're looking at indicas, you're looking at your heavier terpenes or more sleepy, muscle relaxing terpenes. So you got your myrcene from mangoes. You got your beta caryophyllene. You got your sort of more earthy flavors in there. That give you the couch lock sort of feeling, that muscle relaxation, right?
Cool.
And then linalool is another sort of more indica style terpene. Then on the other side, you've got your limonene, so your lemons, that citrusy fresh smell. You got your pinene, so you got these terpenes which are more uplifting. So, you know, you imagine walking through a pine forest. Norska fresh, lovely, I feel invigorated, you know. And one little trick for, you know, the recreational medicinal user is myrcene. It's a great one in Australia. We've got an unlimited supply of mangoes. If you have a mango half an hour before you have your cannabis, you'll get an increased, you know, couch lock effect out of an indica, because
so put it in your smoothie.
Yeah, put it in your smoothie. It'll exaggerate that feeling. So, yeah, it is really important, and I'm a big believer in it. And at PlantMed, our doctors are trained to assess them for you, essentially. So you come in and you say, you know, I know I need this. Well, the doctor will talk to you, see what you really need, and then prescribe you appropriately. Yeah. And that's kind of what you pay for. You know, that's the reason you do it.
Specialist knowledge, right?
Yeah.
Do you go to a GP to go get your wrist reassembled, you know? Like,
that's right, you go to a surgeon.
Exactly.
And there's a lot to consider, especially because every single human being, we've all got different physical, mental, environmental conditions going on. I think, like, it's the like you said, the job of experts and of professionals to really consider all of those complex, conditions, I guess.
And it's like our fingerprint, our endocannabinoid system, which we all have. All mammals have, everything down to the sea cucumber has, insects don't have. Truffle
guys.
mushrooms interestingly do have an endocannabinoid system, so maybe that's why they are so valued, and they're kind of intoxicating when you take them.
Yeah.
But, our endocannabinoid systems are unique. And how we are made up depends how we can accept and use cannabis. And some people it doesn't matter how big your body is or how little your body is either. You can be a massive guy or a tiny skinny old lady, and that old lady may be able to handle a lot more cannabinoids than the big guy.
Yeah.
And it just depends on your personal makeup. So cannabis medicine is so tailorable, so unique to the individual. And that's why you can't just go, here's a one-to-one, off you go, because some people have a lot of trouble with THC. Some people can't have a milligram and they're like, oh, I can feel it. And some people are like, I'm on 150 milligrams a day plus multiple vaporizers, and it's not helping me.
One thing, this is like a stereotype maybe. I've noticed personally, women can actually take cannabis a little more than men. Have you ever found that with patients, like in terms of
I haven't, done the statistics and gone through all that because I'm too busy actually treating people. But generally, I'd say yes. I'd say there's a lot of women out there that are as patients, who are previously cannabis naive or never touched cannabis before, who can take massive doses that would put most of your recreational hard smokers to shame. I've got little old ladies that are on hundreds of milligrams of THC a day and getting on with it fine. It's a bit expensive for them, but can handle it really well. So I'd probably say, and the negative reactions you get from women are a lot less. And I think that might be to do with, coping mechanisms as a male. If you get anxiety, how do you respond to that anxiety? A woman will be more emotionally connected to her anxiety maybe, and talk to her friends or seek something out, whereas a male may turn aggressive, may get manic or psychotic. So there seems to be a little bit more of that on the male side as well. I think.
Know it's not completely uniform, but isn't there the kind of old idea out there that women have like higher pain thresholds in general?
Yeah, there is that, and it's the whole more connectedness because of birthing children and going through that whole process. I mean, that puts pain into a whole new perspective. It's like, it's births at the top of your pain list, and then everything is underneath. So once you've had
nuts,
yeah,
it's about here, birthing.
Yeah, once you've had a kid, nothing worries you.
Oh, yeah, that is very interesting to me.
There's a lot there. Wow. Where to next?
Well, where I get interested in terms of where Australia's heading in medicinal cannabis, it's like, do you think it's going to eventually get to a recreational market here?
Yeah.
How far away do you think that could be?
Within 10 years.
Within 10 years?
Yeah.
That's kind of
maybe a lot quicker. Maybe
Yeah.
a lot quicker. I mean, it's obviously hard to tell. It depends on a lot of factors.
That's it.
But as more and more countries go fully legalized, from medical to recreational legalization, I mean, it opens the pathway up more. When the states
that's going to be a
changes over their federal law, then we're not bound by any conventions. Then it's like, well, we can do what we like really here in Australia.
Yeah. The UN's already kind of said.
Yeah, UN's changed the scheduling. So we've changed the scheduling of CBD in Australia following that UN advice. So CBD, when it's got less than 2% of any other cannabinoids in it, is technically classified as Schedule 3, meaning over the counter from a pharmacist now.
Oh, right, wow.
But there's none available yet.
Yeah, right.
There will be some in the next
Probably
12
about
months.
a year,
It'll be there. So times are changing, which is really exciting.
It is,
Yeah.
isn't it? Like, we're all a part of this now, which is great.
What's it like being at the forefront of an industry like that?
It's great. It's really rewarding. I love my job. I've never loved my job before. I've done a lot of jobs, and I love going to work now. I love helping people. But there's also a lot of pressure. There's a lot of...
Because one slip and everything could kind of come unraveled, right?
There's just so much jurisdiction. There's so much rules and regulations that have to be complied with. And, we've got... Put it in perspective. There's 5 doctors in PlantMed Clinic. We've got about 15 admin staff below them just to keep up with taking calls, putting in paperwork, receiving paperwork back. I mean, by the
You're
time
outnumbered 3-1.
yeah, totally. By the time you get your medicine in your hand, it's been touched or virtually touched at least 20 to 30 times.
Wow.
You know, by producers, admin staff, the doctors, the pharmacists, the TGA. Used to be Queensland Health as well, but they've sort of stepped aside. You know, so there's a lot of bureaucracy and rules involved. So keeping in line with all them is something that I obviously find really important. I don't break any rules because they're there for a reason, and it works as a system for us. So we just work with that system. And I was watching a really interesting podcast about succeeding in the cannabis space from Canada, and it's probably about a 5-year-old video, but it sort of makes it more relevant for us here now in Australia. And there was I can't remember the guy, but it was a really respected business entrepreneur who was talking, and he's like, get used to it. The industry you're in is regulated. It's going to be regulated till the day you die. So get used to it. Even if it goes recreationally legalized, it's still regulated.
Sure.
So there'll still be rules to comply with, so there'll still be licenses to get. And how we shape that, you know, on the positive side, I think that although, you know, a lot of people complain about the regulations, the government's actually been really good, and they actually do listen to people like myself and other bodies who are suggesting ways that we take this forward. It's not just, no, we're going to set the rules like this and that's it. Okay. It's like, you know, they are listening to
they're
us.
In the dark, really. They have no idea how to treat this. It's too much.
No idea. I mean, we're using a borrowed system. The SASB system is a system which already existed pre-cannabis, and it's really for any imported medication or device. So vaporizers are considered a medical device. Nebulizers have to go through this system. So it's tacked on to the side of another system. But that's how we stand, and we just play with those rules.
How do you feel about like an agency for cannabis existing in the future then to regulate this kind of activity, so it's not like a TGA thing?
I mean, you know, it's a good idea. And it just depends on what system of regulation. You know, I was involved in conversations with the Thai government back in 2018 when they were developing their legalisation policy, and they actually took quite a few of my suggestions on board when I see their policies as it's been written.
Wow. That feel good? You've influenced a country.
That's really
does.
cool.
It feels really good, you know, and they've chosen to do things like allow population to grow a couple of plants and utilise that in the medicine process, you know. So, you know, that's something, it depends how you want to develop these systems. Canberra, you know, in the recreational, decriminalised sort of sense, you can have, I think, 3 plants in your house.
2 plants per person, up to 4 in a household.
Yeah, so
outside only.
Yeah, so that's a step, except they're going to get pinched all the time.
That's what's happened.
Yeah.
Like, there's actual
I mean, that's obvious. So that's the government not looking into the reality of the situation.
Sure.
But they don't know.
Yeah, that's it.
So we've got to give them benefit of the doubt. They are there. And
it's very true. You're like, you know, we've had politicians, even Michael Pedersen, the guy who kind of...
legalized an ACT.
Yeah, and in particular, they seem really well-meaning and well-intentioned, but like he's never smoked weed and he's not part of the community and he hasn't been on the medical program or anything like that. None of it is like a personal fight for him. It's more about, well, my constituents asked for this and I could
And
just
that's a good politician, right?
Yeah.
Someone listens to their constituents. So it doesn't matter what he personally believes, he listens to his constituents.
Right, and also like defers to
servants.
experts, you know, like the fact that he's willing to listen to people like you on this question, it's important because he's willing to acknowledge that he doesn't know the first thing on this, really. So it's cool, you know.
Times are definitely changing. It's very exciting.
Yeah.
One thing that I read about, I think it was last week or the week before, there was a bit of statistics thrown around about the approvals going through. We're getting like 9,000 a month through the TGA now.
At least, yeah.
At least. But it's actually young men that are leading the charge with flower prescriptions.
There you go.
And I mean, that makes a lot of sense because, you know, that's kind of the culture that's been built within the recreational space. And now the young boys, I mean, myself kind of included, we're looking for, you know, that high quality, non-PGR guaranteed quality. Where I'm kind of leaning with it is more about the vaporizers, actually. With medicinal cannabis, we are absolutely encouraged to use vaporizers. It's on our prescription. It says vaporize, you know, 0.5 gram twice a day, which is kind of the funniest prescription I think I've ever read.
Most flour is self-administered, self-dose. It almost doesn't matter what I write on the script.
Yeah, because they can do what they please behind What I was going to ask is there actually cause for concern regarding, bong smoking, joint smoking, or, pipes if they so choose? I don't know why.
I guess combustion.
Combustion, is that something that could maybe be thrown in our faces a little bit down the line?
Well, I have had a patient who got investigated by the police for some reason.
Oh, really?
And the only charge was for a bong, for an implement.
Oh.
So bongs obviously aren't...
They're not covered by the TGA.
They're not covered by the TGA, no. So there's only 2 models of vaporizer which are covered by the TVA technically as a medical device.
Oh, wow.
So technically, we can't, as doctors, we're not meant to promote smoking. So, and I don't promote smoking because it's bad for your lungs, right? It makes you cough, it creates mucus. It's not worse for cancer, but it definitely is worse for your lungs. And anyone who's smoked cones for 30 or 40 years, they're not in the best shape respiratory wise. So definitely vaporizers are the better option. Yeah. Whether they need to be regulated as they are, it's kind of, once again, an inherited thing. Oh, it's medicine, a medical device, you need to authorize a medical device. Unfortunately, it puts a lot of expense. The vaporizers that are approved
They're
are
not cheap.
They're high quality, but they're $600 to $900.
Yeah, because they approve the Stores and Bickle ones, the Volcano and the Mighty, but you need to get the medical version of it, not the actual.
So
I don't know what's retail style.
This is a funny one because I'm not a stickler for this particular rule. You're meant to get a SASB approval for your vaporizer. That's the rule, all right? So if you don't have one, are you going to get in trouble? Probably not. Probably not.
Like, who's going to police it, really?
The police know what a bong is. The vaporizers, they'll be like, oh, I suppose that's okay. So, and the price point is the main point for me because, you can get an adequate vaporizer for $150, right? That'll do the trick. Most people don't have $600 or $900 to spend on a vaporizer.
Absolutely.
Yeah, so
on top of medicine costs.
On top of medicine costs too. I mean, a good quality vaporizer is worth it. You get a slightly better extraction rate of medicine from your plant. But I put in an approval for someone who wanted an approval for a Mighty Medic the other day, and obviously the SASB hasn't had many requests for this.
Yeah, right.
Because they asked me for the product information.
Wow.
Yeah, so it may be the first one they've had,
That is amazing. It's kind of weird because if they had more available products on that listing of SASB, then they could maybe even enforce that rule or try to, but...
I don't think it needs to be listed. I don't think vaporizers
doesn't.
need to be listed. It's
Yeah,
a device.
I agree.
It's like, it's like
Do we need to put a dropper on there, It's an instrument rather than...
Yeah, exactly. But the rules are the same as with pharmacy. So they haven't changed any rules for the cannabis industry. And that's people always ask, are these meds going to get on the ARTG or be paid for by Medicare? It's a long way off if it's going to happen. And that's because the same rules apply for any medicine. If you bring a medicine into Australia, you can register it. That'll cost you a certain amount of money and time and make sure you've done the studies. And then if you wanted to get onto the payment from Medicare side of things, you have to then prove that medicine is better or equivalent and at a cheaper cost than a currently used medication.
That's hard with a pharmaceutical,
That's hard to compete against endone and Panadine Fort, which you get for $6 a packet, or even unsubsidised, they're about 30 or 40. There's a lot more bang for buck in that,
There could be an
suppose.
argument, though, about how codeine affects people negatively.
There's a lot of negative side effects, and there's a massive accidental overdose problem on pharmaceutical opiates in Australia.
Yep.
So there's many arguments against it and for cost-wise, but the reality of the rules remains the same.
Yeah, true.
So I can't see that anything getting subsidised quickly.
No subsidised buds is coming soon.
No, not coming soon.
But there are a few private insurers that are helping cover a little bit of the scripting costs. I have seen that around.
Yep. A lot of
knock $50 off or something like that.
Quite a lot of the private health companies will give you $50 off a script.
That's great.
Up to your cap for the year of $300, $400, which is better than nothing. And it helps out. People on the NDIS. There are ways you can get your medicine paid for. I've got a handful of patients who basically, if you need to get a really strongly worded letter from, I'll give you one once you got your approvals, but also from another specialist in regards to, I've tried every other medication, it's not working, but that specialist believes that it's important. So Yeah, you can get your NDIS to pay for it too. So yeah, there's lots of little ways around it.
Yeah. So we're talking a little bit about costs, and I think the biggest thing people talk about with the medicinal program in Australia is cost. Now,
Especially for consultation.
Consultation and all that. But see, I'm on the program, and I mean, granted, I'm a little better off than maybe your average Joe in Australia. Especially because I don't need so much medication, right? Like that's my cost. But you do hear of patients who do need to spend $1,000 to $2,000 a month for their medicine on the medicinal program. How would you address the concerns regarding cost, regarding consultations and medicine? Like, we had the question, why is PlantMed so expensive?
Yeah. So, well, a lot of it is the back end admin. And a lot of it is the skill that you're also getting. You come to a specialist doctor in cannabis, they're going to give you specialist treatment and understanding of, we don't just give out a one-to-one oil. We'll give you out a CBD oil, a THC oil, and you might have multiple choices of, or strains or chemovars of buds to choose from, so that we don't gain tolerance. We can rotate, we can use sativas in the day, indicas at night. So we provide that specialization. So the consult fees cover basically the doctor and the admin and the business running costs.
Right.
Then at PlantMed, we have the ability, luckily, to dispense to our patients. So I'm the medical director there, and I have a rule that we maintain these medicines as cheaply as possible, and still run a business.
Yeah.
So you'll find that your medicine costs at PlantMed will be cheaper than a general pharmacy.
Yeah, for me personally, because I've done my research, right? I've seen PlantMed's a little higher on the consult costs, but I did notice you actually get more time with the doctor.
Yeah.
So it's like that consult cost, while it is higher, you are getting a little more one-on-one time. Because like I've known people that have gone, I won't name the clinic, they're just up the road, but they've gone there and they've gotten their prescription, gotten it in a day, and then it's kind of, they have no follow-up. There's none of that. They're just like, oh, okay, it's someone who wanted flour. They've gotten their flour. Come back in 2 weeks, you can get some more flour. But there's absolutely really nothing about dosing, nothing really about their conditions, none of that.
Yeah.
And granted, a little cheaper, but their actual medicine cost higher.
Much higher,
right?
yeah.
And it's the medicine that really adds up on your fees, at least personally.
Yeah. So that's I have a term for that type of doctor. I call it a churner, and you're just churning through processes and you're just stamping. Okay, and it's not using any medical skill.
Right.
We don't churn at PlantMed. It's tailored to you. It's tailored to the patient every time, and those numbers you quoted, $2,000. Some people do have bills like that, but they're utilizing a lot of cannabis, or they're epileptic normally and using a lot of CBD. The average pricing for most patients is about $250 a month. Okay.
I find mine's, I think, about maybe $350. So
Yeah.
it's not too bad.
Yeah.
It is definitely affordable if you budget for it. It's one of those things.
It's a thing if it works. If you're on 15 different other medications before you get there, and then after a few months you're on 5, well, those other 10, that's money in your pocket.
Yeah.
So you can, and if it works, you'll make it work. But I think, one of the important things is, how much does it cost? Say, what's an ounce on the street? I have no idea of good quality
It
cannabis.
absolutely depends, right? Since COVID, pricing has definitely skyrocketed.
So is quality.
So is quality, though, funnily enough. Quality's gone up, right? Pricing has skyrocketed. We used to get ounces $300-400, normally $350 for a strain. Pretty good quality. Now, $400 to $600, right? Some really, really strong flowers, like beautiful flowers, $600 an ounce, and that's a bit absurd, because when I look at my medicinal, it's cost me like $450.
Yeah, we do. Our standard standard pricing is $420 for the 30 grams, and that'll be of a 20 to 22% high quality medicinal strain.
Excellent.
It's perfectly trimmed. There's no PGR. It's
product
beautiful
every
flower.
time as well. Because,
consistent. Yeah.
Probably my only letdown with the medicinal, because they put them in tubs and all of that, you don't get that freshness that you would maybe when you get a bag. Because they might have been sitting in that tub for 2-3 months, and
that's kind of because of the import reliance we've got in Australia at the moment. There's a few companies coming online, growing in Brisbane and in Australia, Tasmania, Western Australia,
we're all over
New
Melbourne.
South Wales, everywhere, Victoria. And as these companies come online, it's a local product. So it hasn't been sitting in transit for however long. Hasn't been sitting in storage in Canada for how long before it even gets on the plane.
That big issue at the start of the year with the shortage from Canada, like how long was it on the tarmac for? Maybe like 3 months.
Yeah, that's right. I mean, because of the COVID, no planes flying, there was a shortage there for a while, but that's been rectified now, and yeah, supply is solid at the moment in Australia, very solid.
One thing I think that disappoints me that I've seen in Australia is we have companies here growing medicinal cannabis, but it's actually not being sold to Australian patients. It's going overseas.
Frustrates me as well.
Isn't that what? What do you mean? Like,
So that's one of the advantages for producers to set up in Australia is that we're medically legalized, so we can legally export, and we have amazing quality control. So we have a thing called GMP, which means making things the same as you do with pharmaceutical pills, to that level of cleanliness and standard and reproducibility. So when you got that stamp, that product going overseas is worth top dollar.
Wow.
And obviously not every country in the world can export cannabis. So a lot of the big producers from Canada, Israel, the States have got their finger in the pie over here. They might have been, superficially interested in the Australian market, but really they're not. There was one on the news the other day. I think I was part of the little news article. There's a big grow facility happening out near Armidale. Toowoomba, near Toowoomba,
yeah,
that's
huge,
right.
it's biggest in the world, I think, or Southern Hemisphere, one or the other.
Yeah, it's supposedly planned to be the biggest facility in the world. But that's obviously going to produce a lot more cannabis than it's going to be used in Australia.
Yeah.
So their markets export. They're situated next to an international airport. So
I
their
wouldn't have seen
markets
that
export.
like 5 years ago when it was first legalized. That would have been a weird idea.
Yeah, exactly. But it will come to Australian market, but they've got their eye on the export dollar because that's unlimited.
Yeah.
The Australian population's only 20 million.
Yeah.
10% cannabis use, maximum of 2.3 million users in Australia. So it's a big world.
It's kind of frustrating for patients, I'm sure, when their supply is limited and they have to deal with that. And then they hear about the biggest cannabis producers opening up in Toowoomba.
Yeah, that's right. Well, supply is not limited in Australia. That's the thing. There's plenty of cannabis in
True.
the medical market.
True.
You got to get your finger in the door, but there's plenty of ways to do that. There's your local GPs. There's clinics like ourselves.
Actually, maybe let's go into that a little bit, right? So a lot of people do wonder how the hell do they get onto the medicinal program, and they really think they can't get it. But I think most people who are self-medicating with cannabis are probably quite eligible. Most of the time,
sure.
Maybe they haven't even identified what they're actually using it for. I think that's a really common one, whether it's anxiety, depression, insomnia, pain, whatever it happens to be. What would you recommend to someone who is maybe on the green market, as you call it, to do if they are interested in coming into the medical space?
Well, it's really simple. Go and see your doctor. Or go and see a specialist clinic like ourselves if you want that more sort of specialist treatment. The only rule about allowing access to medicinal cannabis in Australia is that you must have some sort of pre-existing condition or ailment. And that condition, you must have tried some sort of conventional medication that either hasn't worked or has been discontinued because of, say, side effects. So sleeping pills, back pain, you've taken a Panadine Fort, sleeping, you've had a diazepam. So most people have fulfilled this. 99% of the population can fulfill it. And if you can't, well, at my clinic, I know what I do. If someone hasn't got into them and they don't tell me they have, I say, what we're going to do is I'll just prescribe you some X medicine. You test it out, see if that works for you. If it works for you, great, you won't need me. If not, come back in a few weeks and we'll continue the process, and then you fulfill the requirements.
Okay, great.
So
one problem that people do have is their GPs just go no.
So the rules have changed a little, actually. So GP opinion can't be swayed. It's like if your GP just says no,
Right.
that's his opinion. He doesn't have to do anything he doesn't want to. He doesn't have to prescribe you endone if he doesn't want to either.
Correct.
So that's their personal opinion. But you don't need a referral from your GP to access medicinal cannabis. So you go to another doctor and say, I want to get some medicinal cannabis for my sleep, and they might be willing to do it. You come to the PlantMed clinic. We prefer some sort of referral or summary from your doctor, so we've got that background information and it's easy for us, and we've got someone to write letters to like we do in a normal medical situation, but it's not needed. So you can self-refer. You can just you can ring the clinic and book in.
You could always ask your doctor for a medical history too, right?
That's right. So if your doctor flat out refuses to give you a referral or prescribe you medication, you can say, well, can I please have a printout of my health summary, it's called, medical history or health summary. That's perfect. Bring that into PlantMed, and that gives us all the medications you've trialed, that you've had before, your previous history, what symptoms and diseases you've got. And then we've got someone to send a letter back and tell that your regular GP how you're going, and maybe it's time to reduce these unneeded medications, which is another big thing. I think, cannabis is not really a friend of the pharmaceutical industry or the alcohol industry.
Right.
If you look at any jurisdiction where it's been medically or recreationally legalized, alcohol use reduces, opiate use is reduced, pharmaceutical profits and alcohol profits go down. So that's one of the reasons that the things are the way they are. But yeah.
Do you think doctors prescribing pharmaceuticals might be involved in that kind of broader, let's call it conspiracy?
No. Not consciously.
Okay.
It's just the way that the medical system works, the way that doctors have been trained to think and prescribe.
Fair.
Doctors, everyone thinks they're really amazingly high intelligence people, and look, they are fairly intelligent people, but they're just following a set of rules, essentially, and treatment plans. Have you got a cough? Yes or no. Go left or right. And have you got a fever? Yes or no. Flow charts, that's the word I'm looking for. So you basically follow flow charts, and these are set systems of flow charts. Have you got pain? Try aspirin. Doesn't work. Try Panadine 4. Doesn't work. Try endone. Doesn't work. Try Polexia. Doesn't work. Try gabapentin. Doesn't work. All these things will be familiar words to people with chronic pain.
Right.
So
you're problem solvers.
Problem solvers, that's right, yeah. So you can have a problem solver, or you can have someone that just gives you a stamp. Depends what you want, and a lot of people just want a stamp.
Yep.
If you want a stamp, go to the cheap consult people, get what you want, and get on with your life. If you want treatment, go to someone who knows. Yeah, that's the way I look at it.
It's interesting.
Yeah, I think so too.
What I was kind of thinking about there is how many years did you have to study for, John?
I was at university for 7.
7?
Yeah.
And then you have like your residency, internship and all that.
Yeah, then you have like 2 or 3 years in the hospital system, and then you're in the public system, and then you can branch out from there and specialise.
So about 10 years, right?
Yeah.
Call it about 10.
Yeah. I'm still studying now, actually.
What I want to tell our audience is, if you're complaining about the fees, just remember a doctor has studied for 10 years, right?
Oh no.
Well, that sucks. Bye.
We'll just continue.
A doctor has studied for 10 years. If you think their consult fees are high, you got to really you got to look into how much has gone into them to even be able to prescribe you that. I think that's a really important thing. When you think of a plumber or a carpenter or whatever,
What's their call out fee?
how much are they charging you just to come to your house?
Especially if they're not subsidized by a government program to do it. I mean, yeah.
So, they've maybe studied their apprenticeship for 3-4 years, however long it takes. I think it's normally 3, right? And then they've maybe got another 5 years experience. That's still not even equivalent to your 10 years potentially just studying before you even become a doctor. So
Good
I think
point.
that's something people really need to consider is there's a lot of work just in becoming a doctor, and then choosing to actually go down not maybe the what I would call mainstream path, right? Like, I'm not going to be a surgeon. I'm not going to be a GP. I actually want to help people with cannabis. You kind of get put into a bit of a box there where you're probably looked at as, I don't want to say like a joke of the medical space, not at all, but more you're a little on the outside of...
You're stigmatized like the rest of the cannabis community is.
Totally, totally. There's definitely that stigma there. It's there strong as ever, but it's weakening. Perspectives of other doctors change. We've got doctors who are dead against cannabis. They straight out... I've had patients scrumple up the PlantMed referral form from the patient, throw it in the bin and say, I'm not giving you that.
Oh my gosh.
Which is, don't even start me. That's disgusting. But that is changing. And those doctors which were dead against, well, we still took their patients. We fixed their patients and sent them back to them and said, can you help reduce their medications now? And then they've changed their opinion. They'll send us another patient, you know.
That's cool.
Specialists especially have been doing that as well, and GPs to PlantMed. And I find that as a really big compliment to the company that we got that changing attitude now. So, I mean, I've got specialist psychiatrists that are specialising in Tourette's and ADHD that send me children. We've got neurologists for all sorts of regions, epilepsy, Parkinson's. We've got spinal surgeons. All sorts of people refer to cannabis because cannabis treats everyone.
Yeah. I really love some of the
No, it doesn't discriminate.
I've watched some of the seminar stuff that you've done for, I think it was the Australian Cannabis Summit. You had a video on there which was about, I think it was autism, ADHD, and Tourette's, and all they all kind of like work differently in terms of their neurodivergence and their relationship with the ECS.
Yeah.
And I guess how cannabis impacts people who have those conditions, live with them.
Yeah, it's really interesting actually because the ADHD brain or the ASD brain will, different areas of the frontotemporal cortex light up. So in a normal person, I think the inside lights up, whereas on an ADHD person, the outside will light up when you give them CBD. So the way that patient's brain is responding is different. ASD, ADHD, OCD, all these conditions are associated with lower than normal circulating levels of endocannabinoids or anandamide and 2-AG.
Wow.
So that's really obviously really relevant as well. Yeah, I've got a really strong interest in that area. I treat lots of children with these conditions and with great results, you know.
Yeah. So it's amazing because, you know, you look at how autism and other related kind of behavioral conditions were treated maybe even 20 years ago. And a lot of it was based upon like behaviorism and the idea that you have to kind of apply this broader social theory onto the kid who doesn't understand.
It doesn't work like that, no.
Yeah, if you're using something like cannabis, they can have a different developmental trajectory.
Exactly, and a lot of people in the recreational market, I'd say, would be undiagnosed ADHD, OCD, autism, Tourette's.
Right.
Japanese word is otaku, you know, so people that are really obsessed and introverted, yet really intelligent.
Yep.
I mean, that's like high-functioning ASD, Asperger's, autism, OCD. There's all these traits involved in these people. And adults that get to that point, adulthood, often self-medicate with cannabis. And I've got lots of adult patients who come back and they've been having great results with cannabis, but we fine-tune that for them. So we add in some oils, we add in some CBD. They've got a much better result, and their flower or bud use will reduce. You know, which is a big thing with when you add in different modes of administration. It's not all about inhaling. You use oral modes as well, and you get longer durations of action. You get higher plasma levels consistently. So the way I explain it to patients is you're already halfway there.
Right.
So someone who comes into me, and it happens all the time. You know, like 15, 20 bongs a day. I do 2 ounces a month. You know. You don't need that much.
You really
Once
don't.
you've got yourself balanced and sorted by the doctors, you don't need 2 ounces a month. You know, some people do still use that, but most people don't require that.
It's kind of interesting how recreational use, it has this, like you say, an overlap with medicinal use. But in many ways, because people are winging it in that space, they can end up using a lot more just because they're trying to cope with the symptoms of their own self-medication, in a sense.
That's right. You can have side effects. There's definite side effects to overusing cannabis.
It's kind of difficult because if you're trying to do it independently, you can miscalculate like just what you're dealing with, in the sense that, maybe you're having those negative side effects and you feel like the way to fix it is to go even further in on it. Like
exactly, and then you get more and more problems and you end up with psychosis, and I get a call from the emergency department.
That's it. It's like, how do we, I guess coming from a doctor who's in the kind of official space, how do we get that education going for people who maybe haven't entered directly into the medicinal space?
Well, you know, sites like the ACS, you know, online education, look past the bong. Look past the end of your bong.
We should write an article. Look past the bong.
Look past the bong at your computer screen and
we'll quote you.
Yeah, and find that information, you know, and you know, you don't have all the information in terms of strength and stuff, but you can estimate and you can work out average doses. You know, average dosing is really hard because different routes of administration, but I've rule of thumb worked out an average oral dose, which is equivalent to, say, a small one paper, one person joint, is about 15 milligrams of THC orally.
Okay.
And that sort of also works with the amount of oral oil that will put most adults to sleep at night.
Cool.
So that's like my standard dose. There's no such thing, but a standard dose is about 15 milligrams.
Where you start, really.
Well, you start lower than that. I start
Okay.
at 2 milligrams.
Yeah, makes
if you haven't tried
Yeah, if
cannabis
you haven't
before.
tried, absolutely.
But usually you'll end up about that or higher depending on pain requirements and other things. Yeah.
One thing, kind of coming into that, people who haven't tried, I think of my parents actually. They're people who absolutely could benefit from cannabis. My dad dealt with stress, back pain, neck pain throughout his whole life, and he's like a constant cigarette smoker. God, I'm so thankful for that in some ways because I'm like, I've never tried a cigarette in my life.
don't go
just
there.
because I've seen my parents trying to quit forever.
Yeah.
My mum, however, she's got, actually my stepmom and my mum, they both struggle to sleep through the night. And I know THC oil would benefit them, right?
sure.
But they have such a fear about actually even trying it because they're like, oh, what if I see things? What if I'm incapacitated the next day? All these things. And I'm like, Mum, you're gonna be fine. But
Yeah, cannabis is seen as some like hard psychedelic for a lot of boomers. and people who
to
haven't
to
done
come
it.
back to my parents though, they're ethnic. I'm first generation Australian. They came from Croatia, Eastern European. You've got that very Slavic mentality going on there, and the propaganda there was probably even more than what was in the US in terms
Very
of reefer madness.
authoritarian policing
Yeah,
as well.
and it's all about being productive and on it. Like you need to give back as much to society without even being. You can't show weakness.
It's like the work ethics involved
right?
too.
It
Yeah.
completely changes the mindset. What do you say to those kinds of people?
Yeah, look, it's a societal thing. It's the way I've been trained. It's the devil's harvest, So it's
a good one, isn't it?
It's the propaganda that has been produced, and it is
Yeah.
propaganda.
Truly.
None of these things are all fallacies, and they're not real. Cannabis won't turn you schizophrenic unless you've already got it, really, essentially. So societal expectations are hard to change. My dad's the same. He can't go there. He can't even go to an isolated CBD. He just because his mind won't let him. So I educate them. I talk to them, and for those sort of people, it's so important to come to a doctor because then they feel safe, they feel secure. I educate them that, yes, I'm going to read you out a scary list of side effects.
Right.
Most of them don't happen.
Right.
If you look on the back of your aspirin packet, there's a scary list of side effects. Most of them don't happen. In fact, cannabis is the safest compound that I know of. It's safer than tea. It's safer than coffee. It's certainly safer than all of our other pharmaceutical medications.
You give me coffee, I'm bouncing off the wall.
Exactly. So, yeah, it's education. It's making that person feel comfortable. It's
tell you
making
what,
that
John.
person feel like you as a doctor know what you're doing and have got their best interest at heart. And if you looked at the demographic of people that came to PlantMed, it's not what you think. Majority elderly, middle-aged elderly women. We have all ranges from 1 year up to 99.
Yeah.
But it's more when you're older, you've got more things wrong with you. That's what it comes down to. When you're young, you're just having cannabis for fun. But often when you hit 40, you fall apart 40s, whatever people want to call it, things start hurting, or even earlier, things start hurting. Your chronic diseases will start to build up. You'll get problems with them. Neurodegenerative diseases are getting worsened by that time. So you need it more. So it's more of an elderly population and education, and never force people.
Yeah, absolutely.
And just say, look, if you notice anything happening, you can just stop your medication, give us a ring. We've got one of the things that we do provide for our extremely expensive fees at PlantMed is great service. So we've got a nurse a nurse on duty all the time. We have complimentary nurse checkups at 3 weeks. Your doctor will see you once a month until you're sorted. Usually that's all sorted by 3 months, and then you go into a maintenance program. And the maintenance program where you just chat to a nurse, extremely cheap, so $40.
Yeah, right.
So, don't do your numbers, in terms of money, and educate yourselves in terms of societal lies.
That's a good point. I mean, especially for people who, they may not be fully convinced, and it might be hard for them to do their own research online because of their own biases and stuff like that. It could be very important to see someone like you
Yeah,
on
for
this.
sure. And even when you go online and you look stuff up, you see biases online.
from other people.
But even in Australia, if you research cannabis, you're not going to get all pro-cannabis articles.
Right,
You're going to
right.
get a lot of negative
Yeah,
articles.
that's
as
something
well.
I've noticed. There's this kind of weird paranoia online about, I don't know, like the lack of evidence, quote unquote, when it comes to using cannabis. Like people seem to think that after years and years of actual study and looking at it internationally, we still don't have enough for GPs
There's so much evidence.
and this is what I'm really concerned that what we're seeing is a kind of, I don't know, like obscuring of the facts in a certain way, because I know that the ECS and that cannabis is a very complex thing and that there's a lot of variability there. But like you'd assume that if it had been approved by the TGA 150 different times, that there's something to it and that there's kind of a medicinal
That's
benefit
like
to
another
it.
fallacy.
Yeah, exactly.
There's heaps of evidence. There's heaps of human studies. There's unbelievable amount of animal studies.
Yeah.
But we haven't been able to do these studies for the last 80, 100 years because of the legalization status of the states who have imposed
Right.
their regime on the rest of the world. So they're just being re-emerged, as a study topic, and there's heaps going on right now.
Cool.
But there's a lot of evidence, and if you say there's none, you got to look up Google. You
Yeah.
Google Scholar, go to PubMed, type in cannabis in PubMed,
Perfect.
see how much comes up. Amazing amount of literature out there.
So you're saying
for
that
these things.
that statement's kind of just outdated at this point.
It's part of the propaganda. It's part of the lies that have been told to
True.
us as a population for 4 generations.
Yeah.
I mean, you can't be expected to know something that was told was wrong for your great great grandmother, your grandmother, your dad, and now you. And
Yeah.
if you've got kids, that's 5 generations that have been told one thing when in fact, turns out, a little aside, the US government has a patent on CBD and THC for its neuroprotective qualities.
Wow.
Yet it's still classified as a dangerous drug, Schedule 1 in the States, which means the same as Schedule 8 here.
Basically heroin or meth.
That's right. And it's definitely not
Definitely
those things.
not. We've hit about an hour, so I'm looking to wrap up. I kind of want to just wrap up on maybe like a really nice positive note of where do you see the industry? Like, what would you like to come out of the medicinal side? We've talked a little bit about patients maybe being able to grow their own in certain areas. Is that something you would like to see? And do you ever see Australia maybe getting into a dispensary model like the States, how they went that medicinal route? Just kind of give us a vision of the future.
Future
Well-
of cannabis.
Yeah, well, we haven't got a crystal ball, but I can have a guess for you.
Yeah, this is kind of your hunch, right?
Yeah, so I think we're going to go into a more legalized model. What I would like to see, a recreationally legalized model. I think medicinal cannabis and using it medicinally in clinics is still valid because people will have ailments.
Yep.
And then people that want to access cannabis through a shop essentially can do that. And I think that's logical and safe for society and will make us a lot of money through taxation.
Yeah.
So I think that's a logical way for our government to go. In regards to people growing their own cannabis, I think we should have a right to.
Yeah.
I think, something's like 3 to 5 plants a person. You're allowed to grow tomatoes, but not everyone does. So and not everyone can grow a good tomato
Oh
either.
man, I keep trying.
Exactly.
And it's not easy to grow good tomatoes.
It's
It
not
really
easy to
isn't.
grow good cannabis either. So that's the thing people forget. So there's always going to be that place for the industry around it. But I'd like to see things ease up a little in that sense. I'd like to see, in the medical sense, I'd like to see it just open up so that it's just a standard script, and it'll still be an
Not
S8
having to go
script.
through TGA.
Not having to go through TGA, be able to write a script, just like we do for endone now. I'd like that to happen sooner rather than later, and I think we're on our way.
What would make it easier for you as a cannabis doctor in the future, like apart from making the script simpler?
Yeah, I mean, get rid of a whole bunch of the admin on the back end would be great for me.
Okay.
Because we've just got so many staff doing that on the back end. I think that's one of the main things. But I think, it's a human right. It's a plant we've grown up and evolved with. We should be able to grow it. We should be able to eat it. We should be able to use it as medicine. like we can with tobacco or alcohol, it should be a choice for a human to make. It's not harming them or anyone else. I think that's a fair choice, and that's where I'd like to see it go as soon as we can.
That's it.
Yeah.
That sounds great.
So we'll see you there soon.
I was going to ask one more with that. When you say like write a script, do you think it should always be towards the product? Like this is more on the flower side, not your oils, right? One thing that kind of mildly frustrates me, you have to get approved for the product individually. Could a doctor, like what I would kind of prefer to see is like, yes, they can be prescribed X amount of cannabis at maybe some sort of percentage per month, and that's kind of like how much you get. Then you go into the chemist or the pharmacist, and then they maybe help sort you out for what you should actually be given. So, they've got their range of products, and they go, would you like to try this one, this one, this one? This is good for this.
I think that's more leaning towards a dispensary model.
Yeah.
I think that's something slightly different. I think that's fine if people want to do that. And really, one step short of that will be to just get rid of the TGA system, which it works fine, and it gives a lot of knowledge about what's going in and out of the market. But if they took that step away, then the doctor could just write a script for whatever product was on the market.
Right. Be more generic about it, I guess, as well.
Well, not more generic, just not have to go through that process. So you can still pick and choose. You can't write a script. Well, it's a funny one because it's not quite like aspirin and generic aspirin.
Right.
Because aspirin and generic aspirin are exactly the same thing.
Okay, I see. Yeah.
So Baba Kush is not the same as jelly beans.
Because they could have different,
very different effects.
Different
It's like, you send someone off with a script for 10 grams of cannabis to the chemist. For insomnia, they come out with Jack Herer sativa or something.
And even the genotypes and phenotypes,
it's not going to work.
they're real different. Yeah.
In that sense, that's probably the difference between medicinal and the recreational dispensary model. In the dispensary model, you're choosing your own thing.
Okay.
With a bit of help with the pharmacist, But medicinal is you're being prescribed a medicine, and you don't need to have knowledge of that. So we'll probably end up with a blend of both, I'd imagine.
I'd like that too.
And then, 20, 30 years' time, we could be in a completely different world. It might just be completely legalized and just a normal thing.
Yeah.
So
Things that seem kind of impossible and weird right now, like the idea that cannabis could be completely legalized, that stuff can just happen.
4 years ago, we wouldn't be having this conversation.
This is exactly right. It's
So,
we can see this radical change occur, and it can seem ridiculous to us sitting here
The
now.
speed of change is amazing to me.
Yeah, me
too. It really is. Where I've come from is in the back. I started off in I hired a room from a local pharmacy, and then I moved to a chiropractic clinic, and now I'm in our own facility, specialized and dedicated to cannabis. I can't. Yeah, 4 years.
4 years.
Yeah, so I can't even thank the universe enough for allowing me this opportunity
That's huge,
to represent. And I hope I'm doing a good job.
I reckon
We
you
think
are,
you're
John.
smashing it, John.
Thank you.
Alrighty, I think with that, we're gonna call it a night or a day.
Thanks for coming on. Really
you.
appreciate
My
it.
pleasure. Thanks for having me, guys.
Thank you.